Hello everyone, welcome to the CTV News on Calabash TV and on the Wave Radio 94.5. I am Lisa Joseph. Despite a containment of the Ebola outbreak in the West Africa region, efforts continue here to have the island up to par in managing a possible case. At the height of the Ebola scare last year, officials indicated that an isolation center would be constructed on the site of the new National Hospital. However, to date, there has been no physical activity towards that end. The Chief Medical Officer, Dr. Marlene Frederick, says the government is still trying to secure funding. The Pan American Health Organization, PAHO, has, however, purchased the prefabricated units for the isolation center. While a time frame for the commencement of construction is pending, Dr. Frederick says the center's purpose goes beyond just treating a possible Ebola patient. And in the eventuality, the government has ensured that procedures are in place.
We also have what we call isolation holding areas. So God forbid, although like I said, we know that the risk is low that Ebola should come, but if a patient comes today, we have a place prepared at St. Jude Hospital. We actually have a ward, more than one bed, prepared at Victoria Hospital where this patient can be housed in a safe way and treated properly. So the idea of the isolation center is actually to have one place instead of 2 or 3 places, one place where we can treat all persons. So the fact that it's not up right now isn't hindering us. But at the same time, as you correctly indicate, the Ebola situation is fluctuating. Sometimes we hear it's dying down, sometimes it flares up again. But our work, all of the preparations that we're doing, be it for Ebola, chikungunya, or any other disease, is not just for the particular disease. It's also to strengthen our whole health system, because we know that there can be other diseases. Ebola may die down, and then there's a Middle East respiratory virus which is going on, in the Middle East for a while, or a new disease might pop up. So the fact that we're spending resources and time in training our persons is not going to be lost if Ebola comes or not. We strengthen our whole health system so that we can respond more effectively to all public health threats.
Doing so, the CMO says will get St. Lucia a step closer to requirements for the International Health Regulation certification by the stipulated June 2016 deadline. And the Ministry of Health is ready to test the national response mechanism with respect to infectious diseases, Ebola to be exact. The Chief Medical Officer says health workers have received training at various levels and the ministry wants to see what the impact has been.
Where the focus will be on the clinical aspect, clinical care, early identification, the way we quarantine the individual to make sure there is no mixing of persons, infected as opposed to other persons who may be in the waiting area. We would also be involved in the fire service in terms of transporting the individual. So all of this will be tested later this month.
The Ebola simulation exercise will be held at the GOSL Polyclinic.
We have spent a lot of time in training and sensitizing persons, in putting measures in place. So we're going to be testing our system with various simulations at various points in time to see whether, things are actually working as we think they should. So we plan on starting this month, very soon, within the next week or 2, with an activity at the GOSL Polyclinic, where our scenario will be that of a person who has been on the island, does have the travel history, but who only became ill sometime after being on the island. As we know, Ebola has a varied incubation period where it can stay dormant in the system for up to 21 days. So it is quite possible that someone who may have been exposed in a West African country would come in and not show any signs or symptoms until after, say, about a week or 2.
CMO there, Dr. Marlene Frederick. Meantime, a trial of a potential drug to treat Ebola has started at the Doctors Without Borders Center in Liberia. The antiviral brincidofovir is being tested on Ebola patients on a voluntary basis. People who do not consent to it receive standard care. Oxford University scientists leading the research say initial results are expected in the next few months. A study involving a similar drug began in Guinea in December. More than 8,000 people have died from Ebola during this outbreak, the majority in the worst affected countries of Guinea, Sierra Leone, and Liberia. While a handful of experimental drugs have been given on an ad hoc, compassionate basis in the last year, none has yet been proven to work against the virus in scientific human trials. Scientists at Oxford say brincidofovir was chosen because it is effective against Ebola-infected cells in laboratories and has been deemed safe in more than 1,000 patients in trials against other viruses and can be given conventionally or rather conveniently as a tablet. Researchers aim to recruit more than 100 people and will compare death rates at the center before and after the trial.